Urgent alert! 21 silent signs that reveal hidden diabetes. Have you ever wondered if you could have diabetes without even knowing it? What signals is your body sending that you ignore every day? What if you were just one exam away from discovering a life-changing condition? Today, we're going to talk about a crucial topic that may be silently affecting your health: diabetes. This chronic condition occurs when your body can't properly regulate blood sugar levels. Many people have diabetes without knowing it, as the initial symptoms are subtle and easily mistaken for other conditions. In this video, we'll reveal 21 signs that may indicate undiagnosed diabetes. Pay attention to each of them, and if you identify any symptoms, seek medical attention immediately. Did you know that every minute a person dies from diabetes-related complications? Let's get started. The hidden origin of diabetes. What your doctor won't tell you about this silent epidemic. Diabetes is caused by problems with your body's production or use of insulin. In type 1 diabetes, the immune system attacks beta cells in the pancreas that produce insulin. This insulin is essential for regulating blood sugar and allowing your cells to get energy. The exact cause of type 1 diabetes is not yet completely known by medical science. Genetic and environmental factors, such as viral infections, can trigger this autoimmune response. Knowledge about the causes of diabetes is your first and most powerful line of defense. In type 2 diabetes, your body develops insulin resistance or doesn't produce enough insulin. This type is often associated with overweight, sedentary lifestyle, and predisposing genetic factors. Gestational diabetes occurs during pregnancy due to hormonal changes and insulin resistance. This type increases the risk of mother and baby developing type 2 diabetes in the future. And the most alarming thing is that many people live with this condition without ever suspecting it. Imminent danger: the devastating consequences when you ignore the signs. If diabetes is not treated properly, it can lead to extremely serious and potentially life-threatening complications. Cardiovascular disease dramatically increases the risk of disabling heart attacks and strokes. This happens because high blood sugar levels progressively damage blood vessels. Diabetic neuropathy causes nerve damage, resulting in pain, tingling, and loss of sensation. Loss of sensation increases the risk of wounds and infections going completely unnoticed. Diabetes silently devastates vital organs years before the first overt symptoms appear. Diabetic nephropathy can lead to kidney failure, requiring dialysis or kidney transplantation. Diabetic retinopathy damages the blood vessels in the eyes, which can cause irreversible blindness. Diabetic foot, with wounds and ulcers, can lead to amputation in severe untreated cases. Pregnancy complications also pose an elevated risk for women with diabetes. These serious complications can be prevented with early diagnosis and appropriate treatment. But you can only take action if you recognize the warning signs your body is sending. Essential guide: the tests that detect diabetes before it's too late. Early diagnosis of diabetes can be done through blood tests that measure glucose levels. Fasting glucose testing requires a fasting period of at least 8 hours. The oral glucose tolerance test assesses how your body processes glucose after consuming a sugary solution. The glycated hemoglobin, or A1C, test reveals your average glucose levels over the past 3 months. These tests are like a window into the future of your health, revealing problems before they become irreversible. This test does not require fasting and provides a broader view of your glycemic control over time. If you are diagnosed with diabetes, your doctor will recommend a personalized treatment plan. Early diagnosis is crucial to prevent serious complications and maintain your quality of life. Do not wait until symptoms become severe to seek qualified medical help. 21 alarming signs that can save your life. Find out if diabetes is already attacking your body. Now, let's discuss in detail the 21 signs that can indicate the presence of diabetes. Stay until the end, because sign 18 is something that most people have but few recognize. It is important to remember that only a health professional can make a definitive diagnosis. Pay attention to these warning signs and never ignore what your body is trying to tell you. Sign 1. The secret revealed: how blurry vision can be the first warning. Blurry vision is a common symptom of diabetes and often one of the first signs noticed. High blood sugar levels can cause swelling in the lenses of the eyes, affecting their ability to focus. In some cases, blurry vision can be temporary and improve when sugar levels are controlled. The damage to your eyes caused by diabetes can progress quietly for years before you know it. If left untreated, this visual change can lead to more serious complications, such as diabetic retinopathy. If you notice changes in your vision, such as difficulty focusing, don't ignore these signs. Regular eye exams can catch problems before they permanently affect your vision. Sign 2. The mystery explained. Why sudden weight gain can indicate diabetes. Unexplained weight gain, especially in the abdominal area, can be a sign of type 2 diabetes. Insulin resistance can lead to the accumulation of fat in the abdomen, even with a healthy diet. Insulin is a hormone that regulates blood glucose levels by promoting glucose absorption. Waist circumference may be a more accurate indicator of risk for diabetes than body weight. When the body becomes insulin resistant, cells cannot absorb glucose properly. This results in high blood glucose levels and fat accumulation, especially in the abdominal region. Maintaining a healthy weight is essential to effectively prevent and control type 2 diabetes. Sign 3. Invisible danger. Recurrent fungal infections that signal diabetes. Recurrent yeast infections can be an alarming sign of undiagnosed diabetes. High sugar levels create an ideal environment for the growth of fungi in various parts of the body. Candida infections are particularly common in people with uncontrolled diabetes. Every recurring yeast infection can be a sign of your body begging for medical help. These infections can be persistent and difficult to treat if diabetes is not adequately controlled. If you're experiencing frequent yeast infections with no apparent cause, consider testing for diabetes. Proper control of sugar levels can significantly reduce these opportunistic infections. Signal 4. Critical alert when frequent urination reveals a serious problem. Frequent urination is directly related to excessive thirst and is a classic sign of diabetes. When there is excess glucose in the blood, the kidneys try to eliminate the excess glucose through urine. This results in an increase in urine output, causing you to need to urinate more often. Increased urinary frequency may be the first detectable sign of diabetes before other symptoms. The need to urinate during the night, known as nocturia, is particularly disruptive to sleep. This constant cycle of thirst and urination can be exhausting and disruptive to your daily routine. If you're going to the bathroom much more often than usual, be alert for this sign. Signal 5. Surprising revelation. Dark spots on the skin that denounce diabetes. Dark spots on the skin, in areas such as the armpits and neck, can signal insulin resistance. This condition, known as acanthosis nigricans, is an indicator of high insulin levels in the body. Acanthosis nigricans causes dark, velvety thickened patches on the skin, which are often uncomfortable. These dark spots can appear years before the formal diagnosis of diabetes, offering early warning. If you notice these spots, it is important to see a doctor for evaluation and possible tests. Acanthosis nigricans most often affects people with darker skin, but it can occur in any type. In children and adolescents, this sign is particularly important as a warning for type 2 diabetes. Sign 6. Insatiable hunger, the treacherous sign even with regular eating. Excessive hunger, or polyphagia, is another common symptom of diabetes that many people are unaware of. When the body can't use glucose properly, it sends hunger signals to the brain. This hunger persists even after full meals, creating a constant feeling of stomach emptiness. Even if you consume more calories than normal, your body may literally be starving cellularly. Polyphagia occurs because, despite high blood glucose levels, cells do not receive energy. This constant hunger can lead to weight gain, especially if you consume caloric foods. This vicious cycle can be broken with correct diagnosis and proper treatment of the underlying condition. Signal 7. Silent alarm. Headaches that can be more than stress. Frequent headaches can be a symptom of diabetes that many people attribute to other causes. High sugar levels can cause dehydration and changes in blood vessels, resulting in pain. Dehydration caused by frequent urination can lead to contraction of brain blood vessels. Headaches caused by fluctuations in glucose have distinct patterns that a specialist would identify. Hypoglycemia can also cause symptoms such as dizziness, confusion, and severe headaches. If you experience frequent headaches along with other signs, monitor your glucose levels. A headache diary, recording when they occur and what you've eaten before, can reveal important patterns. Signal 8. Telltale bleeding. Why your gums can give away diabetes. Bleeding gums can be a sign of diabetes that many people don't associate with the condition. High sugar levels affect gum health, making them more susceptible to infection and bleeding. Bleeding gums often indicate gingivitis, which can progress to more serious problems. Oral health and diabetes have a two-way relationship. One negatively affects the other in a continuous cycle. If left untreated, gingivitis can progress to periodontitis, causing damage to the supporting dental tissues. Maintaining good oral hygiene and controlling glucose levels are essential to prevent gum problems. If your gums bleed easily while brushing, see a dentist and check your blood glucose. Signal 9. Compromised defenses. The cycle of infections that exposes hidden diabetes. Frequent infections, especially urinary and skin infections, can be a significant sign of diabetes. High sugar creates an environment conducive to bacteria and fungi, drastically increasing the risk of infections. Urinary tract infections are common because glucose in the urine creates an ideal environment for bacterial growth. A compromised immune system can turn a simple infection into a medical emergency quickly. The weakened immune system and impaired circulation make it difficult to fight infections effectively. If you're having recurrent infections with no apparent cause, consider getting tested for diabetes. Proper control of sugar levels can strengthen your immune system significantly. Sign 10. Stolen energy. The unexplained fatigue that signals metabolic changes. Fatigue is a common symptom in many health conditions, including diabetes, but it is often underestimated. When the body can't use glucose properly, it doesn't have enough energy to function. This can cause a constant feeling of tiredness, even after a good night's restful sleep. This fatigue is not comparable to normal tiredness. It is a deep exhaustion that not even sleep relieves. Fatigue in diabetes results from the inability of cells to get glucose from the blood for energy. This tiredness can significantly affect your quality of life, making simple everyday activities difficult. If you feel constantly exhausted with no reasonable explanation, consider checking your glucose levels. Signal 11. Red peril. Inflamed gums as a portal to complications. Inflamed, red, and tender gums can be a sign of diabetes that is often overlooked. Diabetes weakens the body's ability to fight infections, making gum problems more likely. Gum inflammation often precedes periodontitis, a more serious infection that affects bone structures. The inflammation caused by diabetes is not limited to the gums. It represents a process that affects the entire body. People with diabetes are more susceptible to gum infections due to compromised immune systems. High glucose in saliva also contributes to gum problems, creating an ideal environment for bacteria. Regular visits to the dentist are a crucial part of diabetes management for early detection. Sign 12. Compromised skin. Itching and dryness. Announce metabolic problems. Dry skin and itching can be symptoms of diabetes, often incorrectly attributed to other causes. Dehydration caused by frequent urination can lead to skin dryness in diabetic people. Circulatory problems also significantly affect skin health, causing dryness and intense itching. Changes in diabetic skin represent severe impairment of microcirculation throughout the body. Dry skin can cause flaking, painful cracks, and tightness, increasing the risk of infection. Itching can also be caused by diabetic neuropathy, when nerves are progressively damaged. If you have persistently dry skin and intense itching with no apparent cause, check your blood glucose levels. Signal 13. The cry for help. Excessive thirst that reveals glycemic uncontrol. One of the most characteristic signs of diabetes is excessive thirst, also known as polydipsia. When sugar levels are high, the kidneys work tirelessly to filter out the excess. When they cannot process all this excess, glucose is excreted in the urine, causing fluid loss. This thirst is not normal. It is an unquenchable thirst that never seems to be completely satisfied. This condition occurs because the body desperately tries to compensate for excessive fluid loss. This cycle of thirst and urination can be physically exhausting and significantly disrupt your sleep. If you're drinking water excessively for no apparent reason, seek medical evaluation immediately. Signal 14. The dangerous transformation. When weight loss alerts you to diabetes. Unexplained weight loss can be an alarming sign of diabetes, especially in type 1. When the body can't get energy from glucose, it starts burning fat and muscle. This can lead to rapid and unexpected weight loss, even with normal or increased eating. Sudden weight loss without effort may seem positive, but it hides serious metabolic danger. In type 1 diabetes, the body does not produce enough insulin for its basic metabolic needs. This loss can be significant and rapid, and is often one of the first obvious signs. If you are losing weight without reasonable explanation, consult a doctor for proper investigation. Signal 15. Digestive system on alert. Nausea and vomiting indicate complications. Frequent nausea and vomiting can be signs of diabetes, especially when associated with other symptoms. These digestive symptoms can be caused by dangerously high blood sugar levels. Diabetic ketoacidosis occurs when the body breaks down fat for energy due to a lack of insulin. Diabetic ketoacidosis is not a mere malaise. It is a potentially fatal medical emergency. This complication results in the production of ketones, acids that can build up in the blood causing nausea. Diabetic gastroparesis, with delayed gastric emptying, also causes persistent nausea and vomiting. If you experience these symptoms along with other signs, seek medical help immediately. Sign 16. Alarming zerostomia. The dry mouth that denounces high glucose levels. Dry mouth, or zerostomia, can be a significant symptom of undiagnosed diabetes. Dehydration caused by frequent urination can result in insufficient saliva production. This condition leads to the constant and uncomfortable sensation of dry mouth that persists even when drinking water. A chronically dry mouth is not a mere nuisance. It is an environment conducive to infections and tooth decay. Saliva helps neutralize acids produced by bacteria in the mouth and protects teeth from cavities. Dry mouth can also contribute to halitosis, bad breath, causing considerable social discomfort. If you have persistent dry mouth along with other signs, see a doctor for thorough evaluation. Sign 17. Compromised regeneration. The danger in slow healing. Slow wound healing can be a telltale sign of undiagnosed or poorly controlled diabetes. High sugar levels damage nerves and blood vessels, impairing blood flow and healing. This can lead to persistent infections and serious complications if not treated properly. A simple scratch that takes weeks to heal can be a warning of a serious metabolic problem. Persistent wounds can become ulcers, especially in the feet where blood flow is limited. In severe cases, untreated ulcers can lead to bone infections, osteomyelitis, and amputations. Examine your skin regularly and seek immediate medical treatment for wounds that do not heal normally. Sign 18. Mental fog. Difficulty concentrating as a warning sign. Difficulty concentrating can be a symptom of diabetes that is often ignored or misinterpreted. Blood sugar imbalances directly affect brain functioning and cognitive ability. Both hyperglycemia and hypoglycemia cause neurological symptoms that affect mental concentration. The brain consumes more glucose than any organ. When levels fluctuate, cognition suffers first. Many people with diabetes report difficulty staying focused, remembering information, and reasoning clearly. To improve concentration, it is essential to keep glucose levels within the recommended target range. If you have recurring concentration problems with no apparent cause, consider checking your blood glucose. Sign 19. Nervous system in danger. Tingling and numbness. Herald complications. Tingling and numbness in the extremities can be important signs of diabetic neuropathy. High sugar levels progressively damage the nerves, causing abnormal sensations in the hands and feet. Peripheral neuropathy causes pain, tingling, numbness, and muscle weakness in the affected extremities. These neurological signs begin subtly, but can progress to irreversible nerve damage. Autonomic neuropathy affects the nerves that control involuntary functions, such as digestion and bladder control. Proper control of sugar levels is crucial to prevent or slow the progression of neuropathy. Protect your nervous system before the damage becomes permanent and compromises your quality of life. 20. Sign: emotional roller coaster. Mood swings linked to diabetes. Mood swings, such as irritability and unexplained swings, can be surprising symptoms of diabetes. Hyperglycemia can cause symptoms of irritability, anxiety, and depression for no apparent reason. Hypoglycemia, on the other hand, can cause nervousness, mental confusion, agitation, and sudden mood swings. Mood fluctuations aren't just emotional. They're biochemical responses to metabolic changes. These changes can be challenging for both the diabetic and the people around them. Proper management of glucose levels, along with emotional support, can significantly improve mood. Don't let mood swings control your life. They can indicate a treatable metabolic problem. Sign 21. Gateway to infections. Oral problems reveal diabetes. Oral infections, such as gingivitis and periodontitis, may be more common in people with undiagnosed diabetes. High sugar promotes bacterial growth in the mouth, leading to infections in the gums and teeth. Gingivitis causes redness, swelling, and bleeding, and is a frequent complication of uncontrolled diabetes. The mouth may be the first area where signs of diabetes manifest themselves visibly to attentive observers. If left untreated, gingivitis can progress to periodontitis, damaging dental supporting tissues and bones. People with poorly controlled diabetes are at higher risk of tooth abscesses and other serious oral infections. Your oral health may be sending important signals about your overall metabolic health. Pay attention. Protection strategy: how to shield your body against diabetes naturally. Maintaining a healthy lifestyle is key to preventing and managing diabetes effectively. A diet rich in vegetables, fresh fruits, whole grains, and lean proteins forms the protective foundation. Regular physical activity and maintaining a healthy weight are essential components of this preventive strategy. Each balanced meal works as a powerful preventive medication against diabetes. Limit sugars, refined carbs, and processed foods to maintain glycemic stability. Stress management and adequate sleep are equally important for metabolic health. Regular checkups are essential to detect changes in blood glucose levels early. Reversal protocol: the way to control diabetes and regain your health. In addition to lifestyle changes, diabetes treatment may include specific medications. Insulin is indispensable for type 1 diabetes and may be necessary in some cases of type 2. Regular monitoring of glucose levels is a crucial part of effective diabetes management. Modern continuous monitoring technology reveals invisible patterns that transform control. For some people with type 2 diabetes, significant lifestyle changes can lead to remission. New therapeutic approaches offer renewed hope for increasingly effective treatments. Never give up on seeking the best possible control. Your body responds positively to proper care. Awaken to a new life, turning diagnosis into opportunity. If you've identified one or more of these signs, don't ignore it. Your body is sending important messages. The diagnosis of diabetes is not a definitive sentence, but an opportunity to transform your relationship with health. Remember that diabetes is a manageable condition, and many people live full lives with proper treatment. Your journey to health doesn't start tomorrow. It starts now, with the decision to take care of yourself. The power to change your future is in your hands through the daily choices you make. Build your support team. Healthcare professionals, family, and friends who understand your journey. Today is the first day of the rest of your life. Make it the start of a journey towards health.